Hi everyone, welcome back to Pharma Hut and Health. Today, we will briefly discuss common health issue that affects millions of people around the world, and that is sinusitis. Before starting the video, it's humble request, if you are new to this channel then please like, subscribe and hit the bell icon to Pharma Hut and Health for more medical informative videos. Your one click can motivate us to make more and more informative medical related videos for you, and if you have any query or question about any health related issue, please comment below. Thanks. Sinusitis is a condition where the lining of the sinuses become inflamed and swollen, causing a range of symptoms, such as nasal congestion, headache, facial pain, and pressure. In this video, we'll discuss the two types of sinusitis, acute and chronic, and their treatment options. Acute sinusitis. Acute sinusitis is a short-term inflammation of the sinuses, which lasts up to 4 weeks. It's usually caused by a viral infection, such as the common cold, and less commonly by bacterial infection. Symptoms include facial pain and pressure, nasal congestion and discharge, headache, loss of sense of smell, fever and fatigue. Most cases of acute sinusitis resolve on their own without any treatment. However, if your symptoms persist or worsen, your doctor may recommend decongestants. These medications can help relieve nasal congestion and promote drainage of the sinuses. Nasal corticosteroids. These medications can help reduce inflammation in the nasal passages and sinuses. Saline nasal irrigation. This involves flushing out the nasal passages with a saline solution to remove mucus and other irritants. Antibiotics. If your sinusitis is caused by a bacterial infection, your doctor may prescribe antibiotics. Chronic sinusitis. Chronic sinusitis is a long-term inflammation of the sinuses, which lasts for 12 weeks or more. It's usually caused by a combination of factors, such as allergies, nasal polyps, and deviated septum. Symptoms include nasal congestion and discharge, facial pain and pressure, headache, post-nasal drip, reduced sense of taste and smell, fatigue. Treatment options for chronic sinusitis include nasal corticosteroids. These medications can help reduce inflammation in the nasal passages and sinuses. Saline nasal irrigation. This involves flushing out the nasal passages with a saline solution to remove mucus and other irritants. Allergy shots. If your sinusitis is caused by allergies, your doctor may recommend allergy shots to desensitize you to the allergens. Surgery. If your sinusitis is caused by nasal polyps or a deviated septum, your doctor may recommend surgery to remove them. Medication for sinusitis. There are several types of medication that can be used to treat sinusitis, including decongestants. These medications can help relieve nasal congestion by shrinking swollen blood vessels in the nasal passages. Decongestants are available in both oral and nasal spray forms. However, nasal sprays should not be used for more than a few days, as they can cause rebound congestion. Nasal corticosteroids. These medications can help reduce inflammation in the nasal passages and sinuses, which can relieve symptoms such as congestion, runny nose, and facial pressure. Nasal corticosteroids are available in nasal spray form and may take several days to reach their full effect. Saline nasal irrigation. This involves flushing out the nasal passages with a saline solution to remove mucus and other irritants. Saline nasal irrigation can be done with a neti pot, squeeze bottle, or nasal spray. Antibiotics. If your sinusitis is caused by a bacterial infection, your doctor may prescribe antibiotics. However, antibiotics are not effective against viral infections and should only be used when necessary to prevent antibiotic resistance. Over-the-counter pain relievers. Pain relievers such as acetaminophen or ibuprofen can help relieve sinus headache and facial pain. The choice of antibiotic for sinusitis depends on several factors, including the type and severity of the infection, the age and overall health of the patient, and any allergies or drug interactions. Commonly prescribed antibiotics for sinusitis include amoxicillin. This is a first-line antibiotic for acute sinusitis in adults and children. It is usually taken for 7 to 10 days. Augmentin, amoxicillin clavulanate. This is a combination antibiotic that is effective against a broader range of bacteria than amoxicillin alone. It is often prescribed for more severe cases of acute sinusitis or chronic sinusitis. Doxycycline. This is a tetracycline antibiotic that is effective against a wide range of bacteria. It is usually prescribed for people who are allergic to penicillin. Levaquin, levofloxacin. This is a fluoroquinolone antibiotic that is effective against a broad range of bacteria. It is usually prescribed for people who have not responded to other antibiotics or who have chronic sinusitis. Zithromax, azithromycin. This is a macrolide antibiotic that is effective against certain bacteria that cause sinusitis. It is often prescribed as a 5-day course for acute sinusitis. It's important to note that antibiotics are not effective against viral infections, which are the most common cause of sinusitis. Antibiotics should only be used when necessary and under the guidance of a healthcare provider, to prevent antibiotic resistance and potential side effects. It's important to talk to your doctor before taking any medication for sinusitis, as some medications may not be suitable for everyone, especially those with certain medical conditions or taking other medications. In conclusion, sinusitis is a common health issue that can cause a range of symptoms, such as nasal congestion, headache, and facial pain. Acute sinusitis is usually caused by a viral infection and can be treated with decongestants, nasal corticosteroids, saline nasal irrigation, and antibiotics. Chronic sinusitis, on the other hand, is usually caused by a combination of factors and can be treated with nasal corticosteroids, saline nasal irrigation, allergy shots, and surgery. If you're experiencing any symptoms of sinusitis, make sure to consult your doctor for an accurate diagnosis and appropriate treatment. Cordially thanks for visiting my channel.